Studying pharmacology is tough, so in this video I intend to make it as easily as it could be. What's going on, guys? This is Nafada the Medic and welcome to my channel. For those of you who are new, I am Umar Nafada, a Nigerian medical student, and I make videos on medicine and lifestyle. I am so excited to meet you once again because in this video I am going to talk to you about how to study pharmacology in medical school. And this video is from my experience on the recently concluded exams that I did in pathology and pharmacology. So this video is totally my experience and the things that I did which I am sure helped me, and I think I'm supposed to share them with my colleagues so that they will also benefit out of it. So let's begin. The first thing that I think helped me during preparing for my pharmacology is planning ahead. Planning ahead means that before I go to bed, I used to prepare things on what to do the following day. So for instance, if I decide to read pharmacology the following day, or I have to read pharmacology, I know which specific system and the drugs that I'm going to read on. Because if you go to your reading table, for instance, to read on cardiovascular pharmacology, you might likely start reading on the antihypertensives, and while reading for the antihypertensives you will begin to think there are also antiarrhythmic, and some of the antihypertensives are also antiarrhythmic. So you will begin to think, yes, let me check for the antiarrhythmic. But if you pre-planned it, you will know what to read, and also you will avoid fumbling, so you will be able to move straight to the point and hit the target. Learn to study drugs based on classification. The commonest classification that helps me a lot is classification with mechanisms of action. Like other chemical classifications and many different approaches of classifying drugs, classification of drugs with mechanisms of action, like for antibiotics, the cell wall inhibitors, the protein synthesis inhibitors, the nucleic acid inhibitors, and the cell membrane inhibitors. These forms of classification also help me because once I remember certain drugs belong to certain classification, I will just depict the mechanisms of action. Even while answering multiple choice questions, I don't have to be fumbling and be thinking deeply because I know certain drugs belong to certain classes, so there is nothing to worry about. Examples of drugs can be remembered easily using their endings, like the angiotensin converting enzyme inhibitors, the ACEIs. They can all be remembered using pril and prils. So lisinopril, captopril are the examples. Like also the beta blockers, atenolol, propranolol, timolol. They are all remembered easily when the endings are being mastered. This is another easy way to remember the drugs. Also, making short notes prior to exams or while having personal reading helped me a lot because textbooks are usually bulky. Making short notes, summaries, and diagrams or even charts will help one to recall it easily. For instance, these are some papers that I made while preparing for the exams, like this one. Between this page and also this one, on these pages, I summarize the whole of anti-asthmatic agents. So if I can summarize anti-asthmatic agents here and compare it to when I intend to open a textbook like this, you will find out that really the notes are well summarized, and this is Katzank. We know how bulky the textbook is. So here are some of the papers that I used to summarize the entire pharmacology, and I found it useful because even lately you can go through them, read them, and understand because you are the one who found it already. Making fun out of pharmacology. Finding funny ways of pronouncing and also recalling these drugs is one of the most important things. For me, I found some funny ways, like in slangs form, to coin the names so that I will recall it easily and also have a grab of it. And when mentioning certain drugs during exams, I make sure that these drugs are pronounced in their correct way. That is one thing that you will not make mistake of. Even if you have a funny way of remembering, try to pronounce it the way it is during exams, especially orals, or to the patients and also to the consultants during ward rounds. Making mnemonics also helped me a lot. So the mnemonics, you can make them on your own so that you should recall them, and there are some preformed mnemonics that you can find from certain books and also some of the online sources. And these are also very useful because I earlier found pharmacology something scary, but as I start doing it this way, I found it very interesting. One of the things that helped me in studying pharmacology is watching pharmacology videos. In these videos, it is not only the classifications, the examples, and other ways. There are different channels here on YouTube that are making videos to teach pharmacology. Some are doing it with mnemonics, some are doing it in visual recall, some are doing even a cartoon format. So actually going through and checking for those videos, either here on YouTube or through other search engines, I think will be of help. Group discussion is one of the vital things that I can say one need to participate in medical school, not only in pharmacology, but in any other course while studying. I hope you find this video helpful, and if you find it helpful, don't forget to click on the like button, the subscription button, and the share button with your colleagues so that they will also benefit out of it. And goodbye.